All right, this lecture will be about the lumbar and sacral plexus. This is the neurals portion of the lower limb. I think you will find it easier than the upper limb and the brachial plexus. So let's get started. So the lumbar plexus, this slide basically sums up everything you have to know about the lumbar plexus. Starting with, it comes from the ventral rami nerves of L1 through L4. Remember that plexus is always ventral rami, never dorsal rami. So we have L1 through L4. And you have to know that there are two nerves from the lumbar plexus, the femoral nerve. The femoral nerve then goes to the anterior hip and thigh. Basically, it comes directly off those lumbar vertebra. Between those lumbar vertebra, those spinal nerves come directly forward, cross the pelvic brim, and go right into the anterior hip and the thigh, next to the artery and the vein. The other nerve from the lumbar plexus is called the obturator nerve. This is going to go through the medial thigh. The thing about the obturator nerve is it is the only thing that goes through the obturator foramen of the os coxa. We have that great big hole and one little nerve. They are named for each other: obturator nerve, obturator foramen. Then we have the sacral plexus. The sacral plexus comes also from L4. Basically, L4 does a Y split. So half of it goes to the lumbar plexus, half of it comes to the sacral plexus, and then it comes down through S4. There is a picture of this in your lab book. You are not responsible for labeling the whole thing. What you need to know about the sacral plexus is, again, we have three named nerves. We have the superior gluteal nerve. Superior means it goes to the superior muscles, so it goes to gluteus medius, gluteus minimus, and the tensor fasciae latae muscle. So those are muscles are superior to the inferior gluteal nerve, which goes to gluteus maximus. Gluteus maximus is a huge muscle, and it's so big that it gets its own nerve, and that nerve is inferior gluteal nerve. The way to remember which one is which: gluteus maximus comes and inserts inferior to gluteus medius and minimus. So since its insertion is inferior, it gets the inferior gluteal nerve. And third, we have the sciatic nerve. This nerve will then go through the greater sciatic notch. It is because of these nerves that, especially in young children, they are moving away from injections into gluteus maximus for like your inoculations. Instead, in children, they go into the vastus muscles, especially vastus lateralis, because you're dealing with, you might hit one of these nerves. Now, the sciatic nerve does split, and you are responsible for this drawing. So if you have the sciatic nerve, and I put in medial and lateral, I want you to think about this as if you're looking at somebody's posterior right leg. So this is the right side, and we are looking posterior, medial lateral. Okay, so we come down with the sciatic nerve, and halfway down, or a little less than halfway down the thigh, it splits, and the tibial nerve corresponds to the radial nerve. Therefore, it goes all the way down, all of the posterior thigh, all of the posterior leg to the bottom of the foot. So the tibial nerve is very long, and it goes medial. Coming lateral is the common fibular nerve, and the only muscle that it goes to directly is the short head of biceps femoris. And then it will split again. If you think about this branch point, this is where the knee is, right here. And at that point, it's going to split. The deep fibular nerve goes to the anterior leg, and the superficial nerve fibular nerve goes to the lateral leg. And the reason for this is you don't want to run the nerve across the kneecap. So you come posterior to the knee, and then you wrap around just after the knee so that we don't have any large nerves crossing the kneecap. There is a note I've made here that the fibular nerves, and we'll see also with the fibular muscles, they have an older name called the peroneal, and that refers to the fact that the leg has the lateral region was called the peroneal region, but newer usage is now to call it the fibular region because the fibula is the lateral bone. If you know the old names, you can use them. I'm aware of them, but if you're trying to learn it for the future, think about fibular because that's becoming much more commonly used right now. And that is the lecture on the nerves of the lower limb.